Hi, very good afternoon, viewers, and this is yet another episode under the flagship program of Get More from Mallapuram. And this is where we want to promote more than the insurance, being happy, healthy, and wealthy for all the people with whom we actually get associated. Herein today we have the most prominent Dr. Karthik. Okay, and let me just give a little brief about Dr. Karthik. Dr. Karthik is an MBBS doctor and a Master of Research in Applied Health Research category. He did his masters in UK, and he is an epigenic consultant. Okay, and for all the viewers here, to make it more easier for you, I'll make it I'll give a little brief on what is epigenic. That is, it is top of the genes. Okay, it is epi on the genes. Okay, so how does it impact? It looks like your environment, your food, your habits, your the way how you lead your life can always have an impact which can be transferable through the genes. This is something which we really got to know from Dr. Karthik. And Dr. Karthik, we are really waiting for your session over here. And there has been huge number of people who are there online right now. And I request you to please take it up from here.
Thank you, Rajshekar garu. Thank you for the introduction.
Thank you.
So, please give me a minute. I'll just share my screen.
Right?
Okay, I think I'm here.
Yeah, it's just coming up. Yeah,
Yeah.
it is. Yeah,
Oh, sorry. Yeah, it's come back. Yeah, okay. First of all, good morning, everyone.
very good
So,
morning.
yeah. So, hope everyone's doing well. Can I have a show of hands as to how many people had your lunch?
Ah, I really had my lunch, and I think people are there to react. All the participants, you can actually react in the chat, and we'll be able to see through the chat.
Yeah.
Oh yeah, yeah, yeah.
Oh, okay.
People are
Yeah.
responding.
I'm
Yes.
getting the chat here. Yeah.
Yeah.
Okay. Please give me- So, yeah, over here. mm, okay. So, I hope, yeah, okay, I'm getting responses. Yes.
Yes.
Okay. Thank
Yeah.
you. So, I hope I'm not so boring today. So, let's just move into the whole presentation. Okay. So, today, I wanted to ask you one more question. How many of you, I mean, you slept yesterday, yesterday in the night, and when you woke up, how many of you felt tired? Can I have a show of
Ah.
hands? Okay.
Yeah.
So,
It
yeah.
was a long day.
Okay. I am seeing quite hands. So, this
Yeah.
looks more like a pattern rather than an individual thing. So, yeah. So, moving forward, so who are we? So first thing here, rhythm, which was formerly Somnifera. So our goal is not just, we're not just professionals. I mean, our goal is not just to make people feel healthy. Our goal is more about, how do you call it, focusing on what is causing your condition, your root causes, and trying to address that. So usually for that, we usually go down to the cellular level, subcellular levels, just the biochemical level, and even down, what as Rashika Garu told, the epigenetic level, and in which your lifestyle, your stress, your environment, they kind of like influence on how your genes are expressed. So, because the reason why we do this is because if we don't do this, this analysis, the problems they're going to repeat, and the problems are not only going to be clinical, they're also going to be financial.
Oh yeah.
Yes.
Yeah. You're
So
right.
yeah. So over here is over here it's not about this awareness session is not only about talking about diagnosis, but this is about talking about what is the whispers that come very earlier.
Okay.
So over here, Okay, so this is the presentation, gut, the second brain, and we are here to talk about why your stomach is running your mood, focus, and energy. So let's move forward. Another question, I'm going to be asking a lot of questions, a lot of interactions.
Yeah.
So on your screen, you could see four questions. Have you ever felt brain fog after lunch? Have you ever felt anxiety before meetings? Have you felt any ice cream cravings at 4 p.m.? I mean, which is going to be another 2 hours. So, or have you just felt low with no reason? Can I have a show of hands?
Oh yeah. I think
Yeah, someone said, yeah.
I
I
think
think
yes,
here,
always.
one of them is saying yes, always,
Yeah.
all of them.
Yeah. Yeah.
But we cannot call this normal. I'm saying two. I mean, this is really concerning, and we cannot call this normal. So let's just move forward. A lot of
Okay.
responses, a lot of them saying at least two. I mean, they have at least two of the four mentioned. So let's be honest about our gut. What if I told you that your gut is the reason you're experiencing all these, what do you say? I mean, at least one out of these four things. So why does this matter? Okay, why? I mean, this session is about gut. We call it the second brain. I mean, I think most of you you don't come from a medical background,
Hmm.
but you might have the question as to why should I know about why gut is my second brain? The one thing is, let's just take. I mean, since we all come from a corporate background, so what do we face? We face long sitting hours. We have erratic meals. Sometimes it's midnight biryani, midnight pizza, especially after the invent of quick commerce.
Hmm.
We can get gratified when we have a craving or an urge. We can instantly get it satisfied. And of course, stress makes a huge part of what of our corporate life,
Correct.
of our work life, and personal life for that matter. Poor sleep. I mean, as the question I asked, how many of you had good quality sleep? And excess caffeine. I mean, over here, caffeine not only applies to coffee, it's also excess flavonoids. It's about tea.
Yeah.
Yeah, I've seen. I mean, some people, they take tea breaks every half an hour.
Yeah. Yeah.
Yeah,
I
I'm a tea
think
lover myself, but every half an hour, yeah, that is something which is concerning.
I have
So,
two of my friends who does that.
oh, okay. Yeah, please tell them to limit tea as much as possible. Yeah,
Correct.
so that is one thing. And moving forward, what are the results of it? Yeah, I'm just doing this long sitting hours. This is my job. Many ask me, this is my job, what can I do? I have to stare at screen.
Ah.
But we also have to know what is going to happen as a result of that.
Hmm.
One of those things is burnout, IBS, which stands for irritable bowel syndrome. Your mood
Ah.
swings. Sometimes you're angry, sometimes you're sad, sometimes you're just so frustrated you don't even know why you're frustrated.
Okay.
And all this can result in low productivity, which is
Okay.
detrimental to your career and detrimental even to the corporate. In a corporate work culture, that becomes detrimental.
Correct.
So, moving forward, burnout. I mean, this is a term which many who work here, especially those who come here for stress management, they tell, "I'm burnt out. I'm burnt out. I'm burnt out." So, WHO has taken note of this and they have given an official definition for what burnout means.
Okay.
I'll just read it out for you. A syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. It is characterized by three dimensions:
Right.
feelings of energy depletion or exhaustion,
Okay.
increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. Burnout specifically refers to phenomena in the occupational context and should not be applied to describe experiences in other areas of life.
Yeah.
Now, here I'm going to ask another question. How many of you have felt at least one of these three things when it
Oh.
comes to your workplace?
Um. Me here. Okay.
Yeah.
So yeah, it happens like no suddenly like no so many things come in like immediately. Like, no? So it requires a lot of attention from different things, and so that's when like the emergency things comes up. Sometimes some claim gets stuck up somewhere. Somebody is just waiting for a discharge. So there's a lot of stress which mounts up. Of course, like 95% of the cases have been taken care by my team. I have a wonderful team, so they do take care. Okay, but few things they just pop up wherein we are we are just completely exhausted on that
Yes.
because we need to
Yeah.
coordinate between so many things, and already there is a pre-planned work which is going on parallelly.
Yes. Yeah.
So we need to manage both and then get the things done. Yeah, we I know it will have an impact on the professional efficacy because now you're focusing on too many things at the
True.
same time.
True.
But yeah, we need to manage, and then probably that's what we say. Like me and my friends, we always say this: perfection is a myth. So,
Yes.
it's perfectly perfect. Sometimes being imperfect. That's okay.
Yes. True.
It's
True.
okay. Accept and then keep going.
True. True. So that being the thing, over here, burnout is a big concern. Why burnout is a big concern is because India as a country loses up to 1,000 crores every year because
What?
of burnout.
Loses
Yes, there
1,000
are there are
crores.
reports. I mean, 1,000 crores. I mean, one thing I'm not sure is whether it is
Okay.
the loss of the income or is it going to be like the potential revenue.
Potential
But
revenue.
they've estimated they estimated the loss to be around 1,000 crores every year.
Okay. Okay.
So
Mm-hmm.
that being
Mm-hmm.
the thing, that is the reason burnout has to be addressed promptly. So over here, burnout is not just like something like mental exhaustion. I mean, we just hard work, so much of work. Yes, I mean, when we are in a high pressure, high stakes environment, yeah, we are bound to have some stress. But this is not about just a mind telling that I'm mentally exhausted. This is more like your biology telling, I cannot maintain it anymore. I cannot keep it together again.
Doctor, how this burnout is impacting the gut and like is there any correlation? I'm not
Yes,
sure
that
on
is
that.
fine. We'll get to it further
Okay.
down the line,
Okay.
of
Okay.
course. So, yeah, moving forward, yeah. So over here, when you think of gut as a food pipe, we put some food inside, it goes inside, it digests, and the nutrients get absorbed and it comes out. But
Yes.
one thing, your gut starts from your mouth. Okay?
Mm.
Your gut has over 100 million neurons. It produces 90% of serotonin, which is a neurotransmitter which is very much important for stabilizing your mood. And more importantly, your gut constantly communicates with the brain, similar
Oh.
to how our computers are connected to the internet.
Oh.
That is
Okay.
how the gut communicates. It is not, I mean, it's not a one-way communication, it's actually a two-way communication. And one of the most important things that the factors through which your gut communicates to the brain, number
Mm-hmm.
one is your gut bacteria, the microbiome in your gut. The second one is something called your enteric nervous system. Enteric referring to intestine. So another thing is your brain. And this is not like I'm telling you, it's just constant. Just like how your computers connect to the internet, sends data packets and receives data packets. This is
Oh.
similar like that. It's constant. So over here, it is not random. I mean, what the gut microbiome you have, let's say the bacteria, the probiotics you have, it is not. Yeah. So the thing is, the probiotics which you have, it is not like what do you say? It is not like random. It is very highly organized. It is I mean, what do you say? It's more of like an organized democracy
Oh.
in our gut. So thing over here is most of the thing. I mean, most of individuals like us, I'm talking all around the world, they're dominated. The whole ecosystem is actually dominated by key bacterial groups. Let's say like bacteroids, firmicutes, and etc. They form the majority of our gut bacteria. They're not passive actually. They are very much important in maintaining your body's balance. Like how do you say? They actually help digest your food. The complex carbohydrates are being broken down into into nutrients that can be absorbed by your gut. And these microbiomes are very much essential. They take a slight proportion of the nutrients in that, but they actually help break them down and make it more easy for us to absorb all those nutrients.
Okay. Okay.
So over here,
Uh,
meet your microbiome. So you have a trillion, 100 trillion bacteria with over 1,000 plus species, and news over here is that it adds to 2 to 3 kilos of your weight.
oh,
Yes, like water weight, that is microbial weight. And what all they influence? They influence your mood,
okay.
they influence your immunity, they influence your cravings, they influence your inflammation, they influence your metabolism. I mean, which means how those nutrients are processed in your body.
Doctor, normally people say you have more amount of C vitamin, you'll have more amount of immunity coming in, a few kinds of vitamins you take, your immunity is boosted up, some kind of thing, right? But you are saying like it's a bacteria which actually takes care of your immunity.
Even if you're,
Sounds,
let's say, you're taking some kind of, let's say, a vitamin C tablet,
huh,
yeah, uh, your gut has to be able to absorb it in order for that vitamin C to go inside your system.
okay, okay.
Actually, I was kind of like, I was like, I mean, I was confused when I first came, when I first started, I mean, learning from my mentor about this practice. He was always focused on gut, 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 gut. I was like, okay, what is this more gastroenterology? And
Ah,
practically, I mean, my area of research was in mental health. So the thing is, it was kind of like, okay, I came here, I thought I could learn a lot about mental health. But this is more about gut. Why is he so focused on gut? So one thing, and then he gave me about a big book about bioclinical biochemistry. I sat down and I studied as to why it was. I mean, it took me 2.5 months to do that. But at the end of those 2.5 months, I understood as to why gut is central. Many think brain is central.
correct.
Actually, the system in our body, when it comes to maintaining something called homeostasis, which means the correct balance of environment in our body, the system is not centralized to the brain, it is decentralized, like blockchain.
Okay, okay.
So that is actually something that was, I mean, it was even wow for me because all these things even I didn't learn back in med school.
Yeah, so doctor, you mean to say based on the environment, you will have different kinds of like what do you call this microbiome in your gut?
Yes. I mean, this research is actually being done in Belgium.
Okay.
They are mapping microbiomes to specific diets, specific, I'm talking about regional groups. And the
Oh.
scientists are telling the proportion of microbiomes, I mean, I'm talking about the overall distribution of microbiome species,
Hmm.
varies every 100 miles you travel. The population, the settlement populations of 100 miles, that is the
Oh.
variation they see.
Oh.
So, which means probably in India, I mean, just if we go from north to south, from Kashmir to Kanyakumari,
Right.
we could see at least 40 different combinations. I mean, if you're traveling a linear line,
Oh.
at least
It
40
is.
different gut environments specific to the populations, at least. And not 40, technically 400 if I'm right. Yeah.
Oh.
So
So
that is the kind of, yeah,
so it is all based on their food habits or things like that.
based on the
Oh.
food habits, based on
Okay.
where they live, the climate,
Okay.
based on the genetics,
Oh, okay.
based on the diseases they have. That
Mm-hmm.
includes diabetes, hypertension, and everything.
Oh, okay. Okay. Mm-hmm.
So yeah, so these are the things. I mean, that are quite. It was a wow factor for me when I read about those things, and then I started digging deeper. I mean, I wouldn't say I'm an expert. I'm still learning, but there are a lot of things that I have uncovered. I mean, the research on this has only started since the last 10 years.
Okay.
Yeah.
Okay. Mm-hmm.
So moving forward, there are some research. I mean, speaking about research, we have this paper that says the role of gut microbiomes in anxiety, depression, and other mental disorders, as well as the protective effects of dietary compounds.
Okay.
Same question when I had for vegetarians. Yes, it also depends on whether you
Yeah.
consume vegetarian food or non-vegetarian food or vegan food or just egg, or if you're a vegetarian. Yes, even the microbiome changes also depend on that.
Oh.
Yes. So over here, coming back to the research paper we have here, the role of gut microbiomes in anxiety, depression, other mental disorders, as well as the protective effects of dietary components. Over here, there is just one line that actually caught my eye, and that's what I've displayed here. Dietary components including probiotics, prebiotics, symbiotics, postbiotics, dairy products, spices, especially to a special mention to curcumin over here,
Huh.
fruits, vegetables, medicinal herbs, and so on could exert protective effects against mental disorders by enhancing beneficial gut microbiota while suppressing harmful ones. So, your microbiota can determine if you
Mhm.
have stress, or stress can determine what kind of microbiota you have. It
Oh,
works both ways. If you have stress, microbiota changes and it could lead to anxiety and depression. That is what this recent research happened in 2023, which was not more than 4 years ago.
oh,
So
that's
these are the kind
really
of research, and they have developed a specific segment of microbiota, gut microbiota known as psychobiotics, which
okay.
means microbiomes in your gut that have an effect on your mental health, which is, I mean, still an area that scientists are studying right now, trying to get more data about how this works. I mean, we have established something in research, something called causation and effect.
Okay.
Yeah, we are
Mm,
able
mm.
to find that A and B are related, but we don't know what is the relation between them. That relation is being studied. Of course, our knowledge in this area, when it comes to peer-reviewed research, is quite limited, but more research is being done as we speak.
Doctor, let me just ask you a question over here. You said like, say your mood is defined by the kind of bacteria what the microbiome what you're holding in your
Microbiome,
gut.
yes,
But at the same time, even if your mood changes, that will also have an impact on the microbiome. Is
yes.
so you mean to say the microbiome changes itself based on the mood, or do we have different sets of microbiome for?
The species, the
Oh,
composition,
so that's the
the
colony what you are
population.
saying.
Yes, the colony, the
Okay,
environment.
okay.
Because when you're stressed, I don't know, you eat a lot,
Ah,
and that changes the microbiome.
oh, the composition of that particular that segment of microbiome actually
Yes.
changes.
It changes. The environment changes.
Okay,
So
okay.
it is kind of like, how do you say, we call it a negative feedback loop when stress is
Oh.
involved.
Hey, is it all done on an immediate basis, or it will take some time for the entire system to change
For the
itself?
entire system, okay, unless and until, I mean, I'll come to that down the line, but still, just a
Okay.
short note over here.
Oh, okay.
Depends on even what tablets you take. It can be, even tablets can has an immediate reaction.
Oh,
So over
okay.
here, yeah, so is it bidirectional and interconnected? Of
Yeah.
course, it is bidirectional and interconnected. All
Okay.
this, I mean, I'm talking about this like jumps from system to system, how it happens.
Okay. Okay.
Yeah.
Hmm.
So thing over here, there is a gut microbiota. The gut microbiota kind of like involved with how much nutrients we absorb, what kind of nutrients we absorb. That goes into the system. So sometimes when we have stress, the cortisol is increased,
Okay.
and it signals the brain to secrete adrenal hormones, and it kind
Oh.
of affects the bacteria. It affects the absorption, and it kind of becomes that whole negative feedback
Ah.
loop.
Okay. Okay.
So this is the kind of effects. There are n number of effects. I mean, we could talk about this all day. A lot of things, but yeah,
Doctor, if it is okay, can I ask you one more question? Like,
yeah, of course, of course.
how do you get so many microbes into into our gut? Like how is it? How does it actually enter us?
Okay, the first way is through our diet. Actually, our diet shapes our microbiome.
Oh, okay, okay.
I mean, because
Mhm.
obviously we are exposed to the environment,
Right.
right? I mean, it starts all the way from mother's milk.
Oh,
Digestion
okay,
starts there.
okay.
So yeah, and of course
Mm-hmm.
weaning and everything. I mean, when it comes to the stage of weaning, what kind of foods are given to the kid, to the baby, that shapes. I mean, there has also been a recent research in Korea, it was based out of Korea. They found
Okay.
out that Koreans, they usually, it was told that Koreans have an allergy to peanuts. I mean, especially Koreans
Yes.
who have born, yeah, who those who are born in Western countries, like let's say United States, or I mean, those are immigrant Koreans, second generation
Milk
immigrant Koreans.
allergy is there. Yeah.
Yes.
Nuts.
The thing, yes, Anil. So the thing is, what they have found out is that giving children peanuts from a very young age has reduced the incidence of peanut allergy
Oh.
in children.
Mm-hmm. Okay.
So this is the kind of thing. This is why, I mean, even gut microbiomes, they also influence what kind of allergies you have too.
Okay. Okay. Mm.
So yeah, moving forward.
Yep.
Uh,
Sorry. Mm.
I'm just getting, yeah, over here. Over here, the association between stress,
Yes.
neuroinflammation, and irritable bowel syndrome.
Oh.
So over here, yeah, we have this the bi-directional communication. I mean, there was a question here. So is it bi-directional and
Wait.
interconnected? I have an answer for it. The answer is over here. The bi-directional communication between the gut microbiota and neurotransmitters, and the neurotransmitter dysfunction in irritable bowel syndrome patients leads to a series of symptoms.
Okay.
Also, probiotics have a role in the treatment of IBS, especially stress-induced mechanisms in IBS. IBS is something what I mean. I was telling it was called irritable bowel syndrome. Those people are very sensitive to foods.
Oh. Okay.
Nowadays, I mean, I could tell you. I mean, anybody over here, you could go to any center of gastroenterology. I mean, for example, let's take AIG for that
Mm-hmm.
matter. You go over there, you just see how much IBS is there in the what do you say? I mean, in Hyderabad. How many people are suffering with this? Because when it comes to the gut, it is not exactly something, when it is a gut based symptom, let's say, for example, vomiting or diarrhea or anything of that sort, people most of the times they're embarrassed to tell it out. Even kids are quite embarrassed to tell to parents or to their friends or to the teachers or anything of that sort. And they suffer with, symptoms like, let's say, bloating or, diarrhea or
Okay.
sensitivity. They're not able
Okay.
to enjoy even the simplest pleasures like food, something like going out and eating pani puri, even that is something that is forbidden to them because of this condition.
Ah. Okay.
Why? Again, it is about gut bacteria.
Okay. Okay.
So over here, I'm having a question. Is there any chance of getting prolonged or incurable diseases due to poor gut? Okay, long-term conditions, they are possible.
Okay.
Yeah, they are possible. So especially when it comes to diabetes,
Mm-hmm.
poor gut health can cause diabetes. I mean, recently, I mean, as I was talking to Rajshekar Garu, recently the International Diabetes Association has recognized, I mean, they've asked WHO to recognize type 5 diabetes, which is caused due to malnourishment,
I was
malnutrition.
shocked to know that. Like, yeah.
Yes, it is actually called malnutrition related diabetes mellitus, MRDN.
Uh,
So yes, is it possible to get prolonged, and even IBS is a what I would say is a long-term condition.
okay. Okay.
Yeah.
Mm-hmm.
So moving
Yeah.
forward, yeah, over here the gut microbiota is involved in the regulation of cognitive flexibility in adolescent mice exposed to chronic physical stress and high-fat diet. So one thing over here is the mice. What happened is a few researchers they wanted to check what happened. They gave it. I mean, over here they just kind of toned it down. I'll tell you an American diet. They fed
Okay.
the mice an American diet. I don't know if you've seen videos of those researchers. They put
Mm-hmm.
the mice. The mice has a natural ability to swim. They put
Correct.
the mice in, kind of like water. The mice. I mean, they didn't have training.
Okay.
So the thing is, one was fed a high fat diet and it was subjected to chronic stress, like running on that whole hamster wheel and everything.
Oh.
Another one was kind of trained and everything, given a good diet and everything, healthy diet and everything. And both were left to find a way in the maze.
Hmm.
The rat that was fed high fat diet and subjected to chronic physical stress failed. It
Oh.
drowned in the water.
Okay.
Whereas the healthy one just swam to the shore.
Oh.
So over here, and what was the reason is something which they which the researchers tried to find out, and they found out
Mhm.
gut bacteria was the cause.
Okay.
The
Okay.
so reading, I'll just read out the excerpt to you.
Right.
Exposure to chronic physical stress and a high fat diet induces cognitive flexibility alterations, which means in our ability to think, ability to comprehend things.
Oh,
In BALBC mice and changes the microbiota abundance. Especially there are modifications in the Bacteroidota and Bacillota phyla and Alistipis spp. I mean, these are all the species. I mean,
species.
one of the
Okay.
things which is in humans is the lactobacillus.
Mm-hmm.
And it also affects the alpha and beta diversity, mostly in males that are subjected to a high fat diet and females subjected to chronic physical stress, which means female rats where the gut environment of the female rats were most, changed a lot when when the rat was subjected to chronic physical stress, and in males it was about high fat diet.
Okay.
So even gender has a variance in gut
Mm-hmm.
microbiota.
Mm-hmm.
It is one of the reasons why we ask for family history in medicine. Because
Okay.
why we say diabetes mellitus does not, it's called as a non-communicable disease, don't communicate from one person to the other. But still, why we ask is because, let's say in a family, a father has diabetes. They
Mm.
follow most of the time, they follow the same diet. The father, the mom, or even husband, wife, they follow the same diet mostly. So when one person has diabetes, the other person is more likely to develop diabetes. It's considered a risk. So
Okay.
that's the reason why family history plays a huge bearing. While any doctor you visit, they'll say, wherever, I mean, does anybody else in your family have the same things?
Okay. Okay. So probably this is the reason why a person in the family getting a particular disease, we see like even the generations they still get the same thing, a similar kind.
Yes.
Oh.
Yes.
Mm-hmm.
So over here, sometimes it's because of genetics, but not everything's because of gut microbiota. Let's say even cancer has a genetic element. Okay.
Okay.
So some diseases like, what do you say? Angioedema, those kind of hereditary diseases, they have a
Okay.
genetic component.
Okay.
But the thing what I'm trying to say is it's not just a genetic component, but there is also an environmental component that also contributes to long-term conditions.
Oh.
Yes, there is
Okay.
also this dynamic. Yeah,
Mm-hmm.
I mean that is the main. The genetic one is the main thing, but there is also this dynamic that cannot be discounted.
Okay.
Yes. So
But
over here, stress and the gut. Okay,
mm,
we saw research papers that tell that stress and gut are related. So when we are stressed, the cortisol increases, which means cortisol is nothing but stress hormone.
okay.
So when the stress hormone is increases, the gut lining becomes leaky. Okay, so there is a condition what we call as leaky gut. Our gut, which means our intestines, they act as a barrier between what we eat, which means the environment and our system.
Okay.
Yeah.
Mm,
So thing is, when that becomes a problem, when what do you say, when the gut becomes a problem, it sometimes either it does not allow the good nutrients to go inside.
into the
The
system.
gut does
Okay.
not only also another thing what I wanted to say, the gut does not only is not only involved in kind of like sending the good ones inside your system, it also protects the bad guys from entering into your system,
Oh.
and
Okay.
your gut microbiome helps that.
Achha. So they
So
are
when
like the gatekeepers.
yes, it is a barrier. It is a, I would say it is practically a barrier that separates your internal system from the
To the
external
extent.
environment.
Okay. Mm-hmm. Mm-hmm.
But when this is kind of like, kind of like disturbed, the gut microbiota is disturbed, it causes those gaps in the absorption that it is not only that sometimes it could be like even the good nutrients are not, it cannot be absorbed, or even the bad, toxins, example, they can be easily absorbed in your gut.
Okay.
So usually this, how can I know all these things are happening or not? Your acidity increases. I mean,
Ah,
let's say you eat something, you start feeling that heartburn over here
correct.
and have that burning sensation, or you have a lot of bloating.
Bloating, yes.
Acidity is something, and also as a consequence of that, the good bacteria they kind of reduce in your gut.
Oh,
Yes. So and moving forward, so what is the corporate connection? How does this translate to the workplace? There is a lot of deadlines. One thing, because obviously
Yes.
we all come from a high pressure, high stakes. I'm talking about including medicine. Medicine is a high pressure, high stakes environment, just like yours, I believe. So over here, these deadlines, if we have poor time management,
Mm-hmm.
or let's say we're not able to, follow productivity techniques, if we don't incorporate productivity techniques, so what happens? These deadlines, they create stress. These stress, they create gut issues. Some people, I mean, you would have, especially those who have IBS. Let's say they think about something. They think about work, a meeting tomorrow, or let's say any kind of thing. They're just going to meet the manager. Let's say HR has called them to the room.
Okay.
Suddenly they have those gut issues. Right? I mean, let's say many of us, before taking an exam or something like that,
Oh, yes.
yes, we have something, or when we see our loved ones, we have those butterflies in the gut, in the stomach, right? That's nothing but your gut reacting to your emotions.
Oh, okay. Okay.
Yes.
I, I've also seen this kind of pressure even in the students, like now when they're actually preparing for the exams, especially the final exams are there, they don't sleep. They're just reading all through the night. They just go into the examination hall. And after the exam, like now they are, they just come and take out the entire stress.
True, true, true. I mean, as a medical student, I have also done that quite a lot of times.
Yeah.
So, yeah.
How can we manage it? Like, can that be corrected by changing the microbiome in the gut?
Okay. One thing, for students especially, I mean, I'm sure you could pass this message on. First thing, the last night, doing a night out before the exam is never going to help. It has never helped me. I've done it for the past, I mean, during my 5 years and during M.Res, I've done all those things. Trust me, it never worked. You're far better off sleeping before the exam.
Yeah.
So one thing when it comes to stress, it's about management. I understand. I mean, we come from a very competitive world, especially India. India is a very, very, very competitive. I mean, what do you say? Population.
Yeah.
It's the
It's
survival of
always
the
a struggle for existence.
yes, yes. So that being the thing, we have to learn to manage our, I mean, be it our studies or be it our deadlines or anything. One thing I would suggest is kind of, have a mood board. Have a mood board. Allocate your tasks. Kind of like find time blocks. I mean, if anybody would like to follow up on this advice, I would suggest you follow Dr. Ali Abdal. I mean, he's a YouTuber. So he's based out of the UK. He's a YouTuber, ex-doctor,
Okay.
who became a productivity expert.
Okay.
I mean, actually, I learned my productivity from him. The usage of, like tools like Notion, kind of like time blocking, kind of like jotting down things. So those kind of things when it comes to productivity, I mean, I would recommend. I mean, not because I'm associated, but because I follow him when it comes to productivity.
Oh, can you just repeat his name, doctor?
Yeah. His name is Dr. Ali Abdal, Ali space Abdal.
Okay. Uttam. Okay.
Yes.
Dr. Ali
And
Abdi.
also
Oh,
for those, I'm trying to do some digital detox, I don't want to look at screens or anything, I can suggest you a book. It's called The Second Brain.
okay.
Yeah. By Tiago Forte. That is Tiago Forte. And I think I could.
Okay.
Yeah, so really it's about creating a second brain, the usage of tools like Notion, Monday.com, Atlassian, which is Trello basically. So usage of such kind of tools and productivity tools and how to create a brain outside of your brain so that most of your repetitive tasks are managed, that you don't forget things, you're on track of everything. Especially this really applies to those who are preparing for multiple exams or,
Yeah.
kind of like have multiple tasks, those who are especially a critical resource in a corporate environment. This really works. So yeah.
Right.
So another thing moving forward, yeah, these gut
Yeah.
issues can cause brain fog. So brain fog is something. How many of you have been experiencing brain fog? Like there's a sudden lapse in your memory, like it's something you said you don't remember. I mean, in the recent days. Anybody?
We are talking on so many things and suddenly we say, oh shit, I just missed out. Where was I?
Yes,
Is
the
that?
loss of continuity.
Okay.
You're on track. You're talking about something, and suddenly you lose track. It kind of thing. Everything fades
Correct.
out.
Correct.
These are the kind of things which are a consequence of stress. Stress, gut issues, they cause brain fogs, and
Oh,
more stress. So this becomes kind of a negative feedback loop.
oh,
More stress, less productivity, the deadlines pile up, and this
oh,
becomes a cycle. It is not linear, but it is a cycle.
oh.
Yeah. My PPT skills
Life.
are not so good, so that's the reason I give it linear. Of
So life is a cycle, so everything gets into the cycle. It
course,
comes
of
back.
course. The thing over here, what we have to focus on, I mean, what practitioners like me help is breaking that cycle. That's where we
Okay.
come.
Okay.
Yeah.
Hmm.
So coming up next, the next slide. Okay. How many of you, what does this remind you of?
Uh, it's a bit of
How many of you have got such kind of messages in your phone? I mean, many apps come up, we open these, kind of like open it up. We just allow all notifications and these kind of notifications come.
Yeah, see, in most of the corporates we have seen, like, there's always some kind of a tea time which comes in. And yeah, we see a lot of gossip also goes on in that area.
Yes.
Yeah, it's a kind of a chill out for some time and then come back to the work again. Yeah. And especially the
Yes.
people who are in the sales and marketing, it's
Mm.
like they have this going on very frequently. Probably
Yes.
sometimes even in the night.
Yes.
Okay. So yeah.
So these things, I mean, this is what usually I call the 4 p.m. crash. So the
Okay.
thing is, I mean, whenever it's 4 p.m., I say, yeah, even my phone, until I recently turned off the notifications, it used to be like, Swiggy, it's chai time.
Acha.
Yeah. I mean, the thing is, yeah, I understand. I mean, one thing I really give them is like brilliant marketing. I mean, it's
Yeah.
not only them, it's about like every food delivery apps or any kind of, I've even seen like cab hailing apps.
Hmm.
Right?
Hmm.
They
Hmm.
also kind of give those, I mean, kind of like reminding us. This is the thing. So the thing is, what, kind of like, these kind of making impulsive purchases. So what happens is, we take most of the time we go for refined carbs. So
Oh.
refined carbs like ultra processed foods. Let's say we take those quick commerce, one of those quick commerce, any kind of products like a biscuit or anything. All those contain refined carbs.
Hmm.
So and poor protein intake. I mean, most of the time we consume is carbs. There's not much protein, and it causes something called as dysbiosis. So dysbiosis is nothing but, how do you say, like, your gut is not functioning. I mean, I don't want to go into the technicality, but give an oversimplification is that your gut is not functioning in a way it is supposed to function.
Okay.
So this can cause, because of this increased consumption of, I don't know, these refined carbs, which is even present in bread or anything, like a pizzas, it
Hmm.
causes an insulin spike. For example, those who have, for example, if you want to check, you could get one of those CGMs, continuous glucose monitors. You could keep that. I mean, there's
Okay.
an app on your phone. It tells you how your sugar levels, I mean, they are throughout your day. The
Okay.
thing is, over there, I mean, once you just take, let's say, any kind of refined, for example, let's say I'm having an ice cream.
Okay.
I'm taking an ice cream, and you could see a sudden spike in your sugar levels in the body. I mean, there are even YouTubers that actually do this. They show you in real life. I mean,
Oh.
in real time. I mean, as to how on eating. I think I don't remember the YouTuber's name. He actually shows the different kind of foods you eat and how much sugar spikes. He has a continuous
Okay.
glucose monitor.
I've seen like when this happens, there's a lot of yarning and people like they want to just go and sleep for some time.
Yes, it is because
All
of that insulin spike, the sugar rush they call it.
okay. Okay. Okay.
Yeah.
Hmm.
So that is something which is very concerning. So coming up to the immune system, so
Hmm.
many people, I mean, even when some of my patients they used to come here and I used to tell them, your immunity and gut are related. So when I
Okay.
tell them, they are like, okay, what does that have to do with this?
Yes.
So sometimes because some people tell that if I drink let's say something cold, I get a throat infection. If I
Oh,
have
yeah.
this, there is a throat infection. I mean, I kind of like have an issue. So these kind of things, what do you say? The more studies about this. There were more studies about this. So, and it has come, I mean, many scientists have found out that nearly 70% of our immune cells live in the gut.
Oh,
And why do they live in the gut? I mean, they live in and around the gut. The reason is because I told you, the gut is a barrier between the environment, the external environment, and our internal system.
right.
So, that being the thing, I mean, these soldiers, these immune cells as soldiers, they stand guard to make sure no bad guys get in.
Okay. Okay. Okay.
But they can only work as so much as, like microbes or anything. They cannot deal with the toxins. They're not equipped to deal with the toxins.
Oh,
So, some people, I mean, there could be increased sick leaves, there are frequent colds, slow recovery. Let's say after, let's say after just something as good as something as common as a common cold,
yeah.
it takes them 15 days, 20 days to recover. Sometimes it's not even the cold, it's the aftermath of the cold, the
Yeah.
aftermath of that infection.
Yeah. See, my
Oh,
good friend, he got a cough. He's coughing actually since almost like 2 weeks now.
mhm.
2 weeks, and suddenly it comes up, and he just coughs like anything, and he can't even talk properly at that moment. Have some water, then it takes a little more time to actually adjust and then talk. This I've seen him since last 2 weeks. Like no, it's been happening to him since very, very frequently.
So, increased consumption of water.
Oh,
I mean,
okay.
is he drinking a lot of water?
He normally drinks a lot of water.
Okay.
Normally, as per as what I've seen.
Mhm.
Okay, so he has to increase more.
Yeah, I mean, hydration is quite important.
Okay.
Is very, very important. I mean, I would say like dehydration actually, I mean, in my practice as I see, dehydration actually compounds the problem, the existing problem. Let's say be it diabetes, especially in diabetes.
Okay.
I mean, why I'm focusing on diabetes is because there are a lot of diabetic cases. It's
Okay.
easier to relate to diabetes. So that's the reason I'm giving diabetes as an example here.
Mm-hmm.
In many conditions, I mean, sometimes an infection, common cold, hydration can have a huge effect in
Okay.
recovery.
Okay. Doctor, there's one more question which has come up from Mr. Prasad. Is poor gut health seen in children? If so, from which age group?
Okay, poor gut health. Okay, how can I put it? The age they can, kind of like they start to eat refined carbs.
Uh,
I would say
you're very
biscuits.
scientific. You mean to say the ice creams, the chocolates?
Yes, yes. I mean anything. Let's say ultra processed foods, basically junk foods. From the age,
Okay.
whichever age they start eating junk foods,
Okay. So
so
yeah.
that's when we can see poor gut health in children,
Okay.
and it is directly linked to immunity.
Ah.
Yes. It is not only about they don't take enough nutrients, it is about
Mm-hmm.
also taking, these refined carbs that kind of, interfere with their immune modulation.
Mm-hmm.
Yes. And not
Ah.
only to the gut, it also extends to the system.
Okay. Okay.
Yes.
There's one more question here. It's Mr. Rahas. He says like now how to get rid of this IBS.
IBS is a condition. It's a long-term condition. I mean, it's something. Unfortunately, our medicine has not progressed to the level where we can
Okay.
get rid of IBS completely. But medicine is progressing. I mean, nowadays there are a lot of treatments, that help us effectively manage IBS as a
Okay.
condition.
Okay. Okay. Got it.
And it
Got
is,
it.
I mean, IBS it differs from person to person. I mean,
Okay.
how it presents. Again, every individual is different. It's there is no again one thing I learned in medicine is a template treatment does not fit. There's no one template that fits all.
Yeah, I think when we had a little bit of discussion, like you were actually explaining me, like the pain is expressed in different ways in different places, right?
Yes.
The same human being, but I think in Africa you said, if I remember, like they experience
I
the
mean, when
pain
it comes to
with only
presentation of
sweating.
yes, presentation of symptoms, it's completely different.
Okay.
It
Okay.
differs from individual to individual, ethnicity, from
Mm-hmm.
which region they come from, what climate is there in their region.
Okay.
All these things kind of, I would say, together, all together, they kind of determine what kind of reaction we have to a particular disease.
Okay.
So it is, I mean, actually, it is something, it was quite interesting. From that, when I came to know this, my approach towards, I mean, it was not like, initially it used to be like, "Wait, these are the symptoms, these could be the diseases." To rule that out, I used to
Correct.
write tests. That's how I used to practice. But
Mm-hmm.
after knowing deeper about this whole gut health, how they have this immune modulation, epigenetics as a matter, every person, I mean, it's like I had to rewrite the playbook every single time I see a new person. I have to write a playbook from the start.
Okay.
The existing
Yeah.
playbook can only serve as an inspiration for me. But for every patient I see, there is a new playbook which I have to write.
Oh,
It is tedious, yes, but does it give results? Yes, it does.
okay. Okay. Okay.
So
Great.
that being the thing,
Yeah.
moving forward,
Yeah. We'll move
yeah.
forward.
So over here, okay, many can ask me like poor gut health. I mean, I think Mr. Prasad asked me as to is poor gut health seen in children? I'll tell you how to know if there is poor gut health. So
Good.
red flags that your gut is unhappy. Starting with bloating. Some people have bloating to the stage that they start feeling pain, abdominal pain.
Yeah.
And they'll take pan tablets and call it a day. Seriously, I have seen many people, kind of like, no issues. I've been taking pan tablets since any doctor subscribed. No, no, I just went to the pharmacy, got pan tablets. Since how long have you been eating? Since last 1 month. Some patients have told I've been eating since the last 3 years, daily.
Oh.
And pan, I mean, I'm taking, I mean, I would say, which is pantoprazole, omeprazole, we call it proton pump inhibitors. I mean, recently, I mean, I was just doing research. I mean, especially I recently had a patient who has been taking pan tablets, kind of like intermittently, not daily per se, but very frequently since the past 3 years.
Oh.
And I had found research papers that say that the abuse of proton pump, I mean, these kind of pantoprazole, omeprazole kind of proton pump inhibitors, which practically, kind of reduce the amount of gastric acid that is secreted in your stomach.
Oh.
It has an indirect effect on your energy levels. It makes us feel a lot tired. It contributes to fatigue, overall low energy levels. This chronic abuse of proton pump inhibitors do that.
Okay. Hmm.
So then I
Hmm.
had to
Hmm.
shift her from a proton pump inhibitor to an antacid like Gaviscon.
Okay.
మీకు ఉంటే please take Gaviscon. Please don't go for that again.
Oh, what is the
Well, then
target for?
is proton pump inhibitors like pantoprazole or omeprazole useless? No, they are useful. But the thing is, they can be used, but we should not abuse them.
Ah,
Yes.
we need to know the difference between the use and abuse.
Yes.
Yeah.
So
Got
whenever
it.
your doctor says, writes a specific tablet, be it for diabetes or hypertension or anything, or high BP or anything, or hypothyroidism for that matter, and ask them to review, please come after 30 days. I would like to place this as a request. Please visit them at least the 45th day.
Right.
Please don't delay that visit. Please don't use old prescriptions to go back to the pharmacy and get more,
Medicines.
yeah, the same medicine again and again. I mean, nowadays, I mean, one good thing I've seen in a lot of pharmacies that they have stopped unless until there is a latest prescription.
They
I'm
will
not
open.
going
Hmm.
to,
Hmm.
kind of like issue the medication. A lot of new generation pharmacists I see,
Oh,
they
yeah.
are, and it is really good to see. So yeah, coming back to the red flags. So first thing is bloating. Second thing is acidity. Third thing is constipation. So why I'm putting a specific emphasis on constipation? Constipation is a symptom actually many don't tell out loud. Many
Okay.
don't even convey. They are very much hesitant to convey because symptoms related to the gut. I don't know. There is some stigma that it seems like it is attached to that.
Okay.
The thing is, it need not be that. There's something you can come, you can talk to your doctor. So and again, loose stools, which is diarrhea. Again, food intolerance. Some people they cannot just tolerate food. Let's say milk in lactose intolerance. They start having
Yeah. I've,
diarrhea.
yeah.
Yeah.
I've also seen people like they don't take curd.
You don't take curd. Yes,
Curd, they don't
yes.
take.
Curd is a very good source of probiotic. I mean, not all, curd is not the only source of probiotic, but it's a very good source of probiotic. And some people are not even able to tolerate curd, which contains very good bacteria, good microbiomes. So these things and brain fog. you're forgetting things, but there's no reason, but you're forgetting things.
Hmm.
Let's say you used to have not immaculate memory, you used to have good memory, and suddenly your memory has declined.
Yeah.
Yeah.
Hmm.
And of course, skin issues, acne.
Oh,
Yes. Especially acne, having your pimples, right?
okay. Okay.
They are very much related to your gut health.
Oh, any spots coming on the face?
Yes. Yes. Your skin is kind of like an indicator as how your gut health is.
Oh, okay.
Yes. I mean, we
Yeah,
also
see,
have.
I've actually seen few people like, as they're actually aging, like, they actually get some kind of a spots on the face, and then we see that is actually growing.
Yes. So even like, let's say, loss of collagen, that can cause skin elasticity issues. It kind of makes your
Yes.
skin more, aged.
Hmm, hmm, hmm.
So these are kind of like, I mean, they have very much relation. I mean, I'm talking about the gut microbiota. Yeah, because no matter how much collagen we take, our gut has to be healthy enough to absorb that collagen.
Okay.
Yeah.
Okay. Hmm.
So if not many things, if not directly, at least indirectly, the gut plays a huge role, central role. Yeah. So moving forward,
Yep.
yeah, yesterday, I mean, when me and Rashtriya were having a short discussion,
Oh,
he
yes.
asked me a question as to, Doctor, what myths are you going to bust? So over there, I mean, actually, I have taken quite a lot of myths actually.
Sure.
So I'll just, but because these are the things, kind of like I saw in my WhatsApp. These are actual questions that, patients used to have asked me during my practice. I just take a few. So first thing, I mean, I'll just, till you come over here, just
Yeah.
eat healthy food and your gut will be fine. This is something what health influencers actually, they're also one of the inspirations where I got these myths actually.
Okay.
It is not about how clean your food is. It is about how much diverse your microbiome is.
Okay.
Now we are in India, we say unity in diversity. It applies to our gut too.
Okay. Um, Doctor, you mean to say like if somebody is interested in eating, say, rice and dal and some kind of
Mm-hmm.
a curry kind of thing, and they
Mm-hmm.
want to eat it on daily basis, 3 times a day, 3 meals a day, but the same thing is what they wanted. Even if they go outside, also they would choose only those things.
Yes.
Okay, so is that's going to affect because there's no diversity in whatever that they are eating.
It could be, I mean, it could lead to a condition where they are not able to properly process other cuisines also.
Actually, they'll not be able to process the other foods.
Yeah,
Okay.
maybe they could have intolerances to other foods also. Let's say I'm here. Let's say I've been born. Like born and brought up in India. I've been only eating, rice, dal, curry, chicken, mutton, and everything. Suddenly,
Okay.
let's say I want to do my masters in, let's say, Germany. I'm going to Germany and eating those breads.
Right.
Obviously, I mean, for the initial few days until my gut gets adapted to the new environment, I am going to have one of the other symptoms. Happens to everyone,
Okay.
especially those who travel a lot.
Okay.
They have this issue. So that's why mostly travelers, I mean, I have a lot of friends, they're bikers and everything. They just stick to omelets. Egg is
Oh,
these days, egg and chapati. I don't want anything else. So
okay.
this
Okay.
is the kind of things. I mean, sometimes we have to adapt to the environment. So
Hmm.
that being the thing. And second, so that is what I mean by microbial diversity. The more diverse our microbe is, the better we're able to tolerate even diverse foods, diverse cuisines.
Hmm.
So that gives us a chance to taste everything in this world.
Okay. Yep. Yeah.
So moving forward, yeah. So moving forward, the second myth which has to be busted is many say, yeah, over here, probiotics fix everything. Probiotics is the best way to fix your gut. I mean, this is something like I don't know. It has become kind of like what do you say? They're eating those fancy yogurts, ordering those drinks, reset gut reset drinks and
Yeah, the
everything.
probiotic drinks we get. Yep. Oh,
Yes.
full case we get
So
it.
yeah. So the thing over here is, if that is the way, I mean, seriously, no one will be more happy than me. Because trying to map what is your gut bio. We either, I mean, every time I send it for a gut microbiome test, I get around 12 to 12 to 15 pages of reports.
Oh,
Yeah,
okay.
it takes me around at least 3 hours to crack one report, just to know what is wrong, what is going wrong, what is happening. So if probiotics can fix everything, it would make my life a lot easier.
Oh. Oh, yes.
Unfortunately, that is not the case. So, the thing is, it is not about the probiotics. It's not just you keep eating, let's say, that fancy yogurt or you keep drinking that fancy drink. That is not going to, kind of like serve it. We have to learn to eat a lot of different kinds of fermented foods.
Okay.
Something as simple as idli or dosa, it's fermented food. Curd is fermented. So that is where we get this diverse bacteria. Bread.
Okay. Okay. Hmm. Hmm.
So
Hmm.
these are the kind of we have to what do you say? The commercial products which we usually see, they only have specific strains of bacteria.
Okay. Okay.
Yeah, it has probiotics, but does it have all probiotics? That becomes a question. So it is like it's not that just probiotics don't help; they actually really help.
Okay.
Yakult. I mean, I'm a big fan of Yakult.
Oh,
Everyone
okay.
in my family is a big fan of Yakult.
Okay.
Yeah. So that's the thing. Yeah, they give probiotics, yes. But do they give everything? Yakult, I think it has only three strains, if I'm right.
Okay.
So sometimes what I suggest over here is we should not rely on only one source for probiotics.
Okay.
So that being one thing. Next thing they say, fiber is just for digestion. Yeah, this is something they say. You take good
Yeah.
fiber, many say it helps this psyllium husk and everything. They say it. But one thing actually, it is fiber is actually a what do you say? It's a neurochemical precursor, what I call it.
Okay.
So how is it? Just because these fiber which can be fermentable fiber we call it. It actually is the fodder for the good bacteria that helps regulate our gut-brain axis.
Okay. You will say that what are the good bacteria is there? This is going to
Yes,
be a food for them to
yes,
develop
because
further.
we cannot digest fiber.
Oh, yes.
Yes, fiber, when it comes to fiber, it helps us in two things. One thing, I told you about the insulin spike, right? Fiber helps lower that insulin spike.
Okay.
That's why we eat a lot of fiber diet. And second thing, what fiber does is it helps us, move, the through the intestines. The movement through the intestines is
The
more better,
bowel
so that
movements
you
will be
don't suffer
better.
from, yeah, that you don't
Okay.
suffer from constipation. It helps alleviate constipation.
Okay. Got it.
Now, recent studies have told that along with that, fiber also is the food, the fodder for gut microbiota.
Okay. Okay. Okay.
That is one of the reasons why fiber has to be included in the diet.
Mm.
Yeah. So it is not about, so we could talk about fiber is not just about, it's not only about bowel movement. You're just having constipation, you take fiber, it's done. No, it is not like that.
Mm.
It is more about even your brain signaling, your chemical signaling, neurotransmission,
Correct.
right? So that is the thing. And second thing, and the next thing, usually, there is this new trend which I've seen. It's called calorie counting. Maybe like, actually there was one app, I don't remember the name of the app. I mean, it's really a useful app. One of my clients was like, I mean, he's a bodybuilder and everything. He used to be like, he just came over here. It was some day I just gave him some sweet. So he was like, Doctor, sir, no, sir, I'll get 500 calories, 600 calories.
Ah,
So I was like, okay, 500, 600 calories, you're going, anyhow, you're hitting the gym. So it's okay, it's gonna be okay. One day it's okay. And he was like, no, 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 doctor. And he started taking that app and he put in, I mean, I'm taking so much and I'm on a calorie deficit diet and everything. So I was
okay.
like, I mean, it's something called as, it's either black or it's either white. There is no shades of gray. That's the thing. So kind of like, I'll tell you, it doesn't matter. Like the calories, I mean, calories do matter, but more important than calories, it is the meal timing.
Meal time
Yes.
matters. Okay.
Erratic meals. Please, please, please set a meal time. Your work is going to be there. Okay. You have to eat healthy. Eating healthy alone is not important. You have to eat on time.
Time.
Yeah.
Mm.
Many says
Mm.
that this, what do you say, this meal skipping, kind of two meal a day. It kind of improves your metabolism. It kind of helps you burn. Yeah, especially those are all known as weight loss regimens. They starve themselves.
Okay. Okay.
So
You,
this thing actually many they think is that the health influencer. I don't even remember the name they were telling. I mean, after yesterday our discussion, I was just going through all these reels.
okay.
All these things. It was kind of like It was kind of like the meal timing does not matter. Meal timing actually matters. Just like how our body's, hunger is tuned, like this microbiota also is tuned. Okay, this time I'm going to get breakfast. It's going to be, high carb. This time it's going to be a lot of protein. It doesn't matter whether you're eating 2 times a day, 3 times a day, 5 times a day. It does not matter. But what matters is
Regular.
if you're eating on time. Is it on the right time? If morning or breakfast is at 9, try to complete it by 9. Maximum 9:30. At least put some good things in your mouth, like a fruit or anything. If you're not able to eat like dosa or idli, some fruit would do. But
Okay.
please do it on time.
Have it. Have some kind of food at that time.
Yes.
Okay.
And moving forward, they say gut issues are mostly about food. This is something they say. They have gut, mostly it's about food and everything. Stress can also cause gut issues. I mean, as of we were talking, and all these research papers keep reinforcing the same thing. Chronic stress can also induce gut issues.
Oh,
Yeah.
yeah.
Another thing, yeah, this is something like they say protein, protein, protein. I mean,
Yeah.
this was an
Protein diet.
influencer. Yeah,
Proteins.
this
Yeah.
was an influencer from the US actually.
Okay.
Yeah, he's a bodybuilder. So he says like all he talks about is protein. He's also a chef.
Okay.
Yeah. So he's kind of like, protein, protein, protein. Protein is not the only answer. Consuming a lot of protein is not the answer because if you eat a lot of protein, more than what your colon can absorb,
Hmm.
it starts to stay in the colon,
Oh.
ferments in the colon, becomes a substrate, and it could create like even sometimes it's even harmful metabolites like phenols, yeah, or even ammonia, because protein has a lot of NH3 group in it.
Oh. Okay.
Yes. So that being the thing, that is a myth. So that is what you say. Consuming a lot of protein without that, addressing a microbial imbalance. Okay, that is not called as an optimization.
Doctor, how about the people who are having this habit of taking alcohol
Mhm.
very frequently? Like,
Okay.
it's
Yeah.
could be a good partying person or something like that, or even at home on a regular basis. So, will that have an impact on the gut, which the
Of
microbiome?
course, alcohol definitely has an impact on your gut.
Okay,
Yeah,
okay,
alcohol is still classified. I mean, I think it is still classified as food in India. Last I remember.
okay, okay.
So it is subjected to be regulated as food, alcohol. But the thing over here is, even alcohol is a fermented product.
Yes.
Alcohol is a fermented product. That also has, what do you say, potential to be a good probiotic and postbiotic. I went to a conference in Bangkok. It was about medical lasers. So
Okay,
over there, I met a clinical pharmacist. His name was Dr. Matthias from Germany, and he told me one thing. It is not about the substance, it's about the dosage.
okay,
Yeah, it doesn't mean I'm advocating drinking. If you can stop drinking, please do it.
okay.
Your gut will thank you.
Yeah. Right.
So, yeah. So, that is a thing when it comes to gut health, when it comes to alcoholism, or even smoking for that matter.
Mhm.
Smoking wreaks havoc on your gut microbiome.
Okay, okay.
Yes. So that being the thing. And moving forward, ultra processed foods. Yeah, when it comes to ultra processed foods, we talk about all this confectionery and everything, just keep increasing weight, increasing weight, increasing weight and everything.
Mm,
Especially
mm.
in kids. I mean, I think Prasad Gar over here asked, is poor gut health seen in children? If so, from which
Yeah,
age group? In children, I'm telling you, it can directly affect their academic performance.
correct.
Giving them access to these quick commerce apps. I mean, kind of like, yes, if they want something healthy, please, if it is something healthy, it cannot be confectionery that is made out of sugar or ultra processed high fructose corn syrup. It could be something that is made out of honey. There are
Mm.
products that are available that is non-sugar. I mean, for that, please don't go for artificial sweeteners. I wouldn't recommend artificial sweeteners like aspartame or anything, but at least go for something that's made out of honey. Yeah, like
Okay,
chicken. Those kind of things are really good snacks.
okay.
So
Yeah.
that is one thing. Why? The reason is because since we already have established that gut microbiota can affect memory,
Oh,
and
yeah.
in children, it can affect. I mean, if it is something, I mean, in a competitive country like India, it could be the difference between, getting into medicine or, getting into, and any other field, maybe.
Any
Because
competitive
I,
job,
I
yeah.
come from, yeah, because I come from that, high pressure thing, and practically my inter college was a pressure cooker.
2 years pressure cooker.
Yes, yes, yes. It was a pressure cooker, basically. So over there, every score, every point mattered for us.
Oh, yes. Yes.
Yes.
Yeah.
And the kind of like this thing, I mean, now it has changed. I mean, nowadays, kids have, access to information. They know the diverse careers and everything. I mean, really, I mean, there was one of my relatives, a distant relative of mine. The guy, he was doing his 12th standard. He told me, I want to get into design, industrial design. I was really happy because when I was in I didn't even know something called bachelor's in design existed. So that is the kind of the diversity when it comes to careers over here. So over here, I'm telling you, and moreover, competitive exams. When it comes to competitive exams, let's say I don't know any of you are preparing for public service commission or anything of that sort. I'm telling you, starving yourself and reading all over the nights. I'm telling you, that is not going to help you in any way. Space out your reading. I know you're working. I mean, you might also be reading or preparing for any exams or anything of that sort. Space out your reading. At least if you're reading 1 hour a day, it's enough. But please do it daily rather than stack it up
It
in.
is in habit. Yeah.
Yes.
Yeah. Somebody actually really told, like, habits form, the habits what you form will actually form your future. And the successful people always found the way of creating the habits which unsuccessful people doesn't like to do.
Yes. Yeah. Do that.
Yeah.
So that being the thing, this is why the ultra processed food is where it comes into the whole being. It is not only about it increases weight. Oh, I'll put on weight if I eat that. No, it is not only about that. It affects your performance.
Okay. Okay.
So moving forward, this is one thing. Okay, I wanted to ask a very important question to everyone. I mean, I would like everyone to type yes or no in the chat.
Okay.
How many of you have a stock of at least one antibiotic in your home? Okay. You yourself have told yes. I mean, if it is no, you can please type no.
Actually, like, sometimes the doctor prescribes, so we get it, and they give a 5 day course, and we use it for 2 days, and then the 3 days is stopped up.
Mhm.
So yeah, yeah, it's an abuse, but yeah.
Yes. I'm telling you, what happens in, let's say antibiotics is basically, I mean, as the name suggests, antibiotics.
Huh.
It
Like,
goes against the biomes.
okay,
So, unnecessary taking antibiotics will completely disrupt your gut microbiome environment, especially in the
okay,
long term. I mean,
okay.
as we were discussing, some people like, okay, if they feel like they're going to get a sore throat, they just take a dose of, they call it prophylactic antibiotics. And prophylactic means, kind of like medicating themselves before, the condition has actually progressed to a clinical symptom.
Oh, okay, okay. Hmm.
So this being the thing, what happens is it actually these antibiotics. I mean, the overuse of antibiotics, not just using antibiotics. When it's a doctor prescribed antibiotic, the doctor will also prescribe a solution for it
Yes,
because he
yes.
knows what kind of effect that antibiotic is going to have on the gut, and they will also adequately prescribe. I mean, probiotics or the diet modifications or anything. Doctors would do that.
Yes.
But most of us, I mean, including me, I mean, when I was before a doctor, I just used to go to the doctor. Okay, he has to come after 7 days. Oh, who's going to go after 7 days? It's just everything's all right, right? So
Yes.
we can just move on with our life.
Hmm.
This
Yeah.
was me even before I became a doctor. This was my
Hmm.
mindset. But
Yeah.
thing is, there is a reason why we write review after 7 days or review after 5 days for that matter. Please do that, Vijay. I mean, if not, then at least within a certain time frame,
Oh, yeah.
as
Yeah.
early as possible. Yeah, so that's one thing. These antibiotics, long-term use of antibiotics will completely, kind of like erode your bacterial environment,
Mm-hmm.
and that is going to cause more harm than good.
Okay.
Yeah. So that being the thing, and coming up to the over here, all curd is probiotic. Yeah, the last one. All curd is not probiotic.
Oh,
Yes. The probiotics, the diversity in probiotics, it differs. Curd that you get from A1 cow milk,
okay.
curd that comes from A2 cow milk, curd that comes from buffalo milk. Yeah.
Right.
If you're trying to have curd, please try to cut curd that even comes from goat milk.
Correct.
Yes.
Yeah.
These things, they have all different species of microbiota there.
Okay.
So, kind of instead of trying to go for like one single brand of curd or,
Totally
even
done.
with
Okay.
species of cows, they say the microbiota it differs. What is there in the curd? The probiotics differ in the curd, strains and the species.
Okay.
So that being the thing, I mean, try to alternate between different types of curds.
Mm-hmm. Okay.
So that could be very much beneficial. So not all curd is probiotic is like one probiotic. There are different kinds of different strains of probiotics. One thing is
Mm-hmm.
the more again unity in diversity.
Oh, yes.
When there is a lot of diversity in your gut,
Mm-hmm.
it functions in unison with one goal. That is better.
Okay.
Yeah.
Got it.
So okay. So over here, now we understand the science, what is happening. So, it should be like by this time, a question would have popped up in people's mind. Okay, he's just talking about what are the problems. So, what is going to be the solution? So, when it comes to solutions over here, I'll tell you number one, a good day starts with good sleep. So,
Mm-hmm.
number one, sleep well.
Sleep well. Okay.
Yeah, don't exhaust yourself to sleep. I'm keeping on watching Instagram reels and YouTube videos and when I'm sleeping. Please don't go to that. That would be number one. A good day starts with good sleep. I
Yeah.
strongly believe. So, number two, make sure you have breakfast.
Okay.
You're having lunch or you're eating a heavy dinner, that's different. Make sure you're having breakfast and make sure it is on time.
Okay.
Yeah. Number three, make sure you're hydrated.
Oh, yeah.
So many people would ask me, how do I calculate how much I have to be hydrated? Reputed academies, they suggest that you drink at least 32 milliliters per kg of body weight. So what you do is take your body weight, multiply it
Okay.
by 32, and that is how much ml you have to drink at least for bare survival.
Okay.
If you're
So,
dehydrated, I mean, since it's summer over here, please add 500 ml to it.
okay. Okay.
That is how
So,
much.
if somebody say 60 kgs,
Yes.
okay. So,
So it roughly comes to 1.8 liters.
okay. Okay. Okay.
Yes, that's something they have to drink for minimum survival. It's not 8 liters a day or
Right.
7
Right.
liters a day.
Yeah.
No.
We used to have that, like, 8 liters in a day you
Yes.
have to
Yes.
drink and,
Please don't fall for that. This is
okay.
how much you need, and since it is summer, please drink 500 ml extra because there
Extra.
will be more excretion through your sweat.
Correct. Correct.
Right? Yeah.
Mm.
Especially for those who have diabetes, you have to make this a mandate in your life.
Okay.
Drink this much water
Yeah.
every single day, or else it creates a lot of complications.
Mm-hmm.
When it comes to food, please avoid ultra processed food.
Right.
Yeah, home cooked meals, I know it might not be, kind of like possible for each and every person,
Mm-hmm.
but at least try to be conscious about what you're eating.
Correct.
Make sure it is from, a good source.
Right.
And next thing, please avoid seed processed oils,
Okay.
especially packaged oils. Please try to get cold processed oil.
Okay.
Yeah, that can improve your lipid profile significantly.
Okay.
Yeah, and if you want even a better substitute than cold pressed oil, please go for ghee.
Go for?
Ghee.
Okay. Ghee. Ghee is the
That
best.
by far. Yeah, ghee is the best.
Okay. Hmm.
Yeah. So another thing, coming down to your screen time, very important thing that disrupts your causes your stress levels, causes your one of the major contributors to the
Mm-hmm.
imbalance in your gut is your screen time. When it
Yeah,
comes to screen time, please follow two things. So the first thing, I mean, the two segments. The first segment is please always activate a blue light filter on your screen
correct,
or wear a specs. I mean, there are also non-powered specs that have blue light filters.
correct.
So please wear that while you're working, while you're looking at your screen. That is the first segment. And second segment is half an hour before sleep and 1 hour after waking up, please make it a mandate, no screens.
Okay.
No screens, no matter how urgent, everything can wait. The heavens are not going to fall. Please, if you can't follow as soon as after you wake up, at least until you brush your teeth. Yeah? Before sleep, half an hour, please make it a mandate. And do not keep your phones beside you while you're sleeping. Do not. At least if you're
Very,
keeping it, yeah, at least if you're keeping it beside, at least put it on airplane mode. It is okay. The heavens are not going to fall. I mean, looking at that one last reel, not looking at that one last reel or, not, kind of like swiping off that notification, it is not going to affect our lives. It's okay. I mean, when we tell someone that, it is time, I want to sleep, I'm sure our loved ones will understand.
true.
So with these little tips, these are the generalized things I can give. Rest all I have to give it to specific. It differs from person to person, as I tell you. Yeah.
Yes, yes.
So over here, please take a lot of yeah.
Yeah, doctor, if anybody wants to meet you in person, like have your appointment,
Of course.
yeah,
Over here, I could just give you. I'll just complete this. I mean, in the end, I have the
yeah, yeah, and
address.
then you
Of
can
course,
just flash your contacts because
of
there's
course,
a
of
lot of
course.
things which need to be changed by everyone to have a better life style for
True, true.
themselves and live longer, and
Yes.
being happy and healthy
Of
always.
course.
Okay, yeah,
So to
yeah,
summarize everything, your gut talks to your brain daily. Your stress levels changes your microbiome, and
correct.
by stress levels, your microbiome, also your energy levels, how you feel tired, frustration, and everything. The small habits are
It's
very more important than your drastic diet change. Please don't go on those fancy diets. Try to inculcate it little by little.
yeah. And
Yes.
and
So
probably just to add up, like we should not get prey for the kind of marketing which is happening for the symptomatic treatments, and also for where the people are focusing on making money on multi-drug resistance,
yes,
right? Okay, and yeah, let's all focus on the roots so that the shoots can be much stronger, healthier, and much flowery and much fruits coming up for all of us in life. Okay.
true.
Yeah,
So moving forward, your consistency beats perfection. You need not do it every day, but make sure you do it most of the time.
most of the time. Yes, yes.
So that is something that really matters. And let me tell you, perfection is a productivity killer. I was a perfectionist, and trust
Yes.
me, it has backfired a lot.
We always say this, like even in my team we always say perfection is a myth,
Yes,
progress is the reality.
true,
So
true.
we always do progress.
Yes, and
Okay,
practice does
yeah.
not make perfect. Practice makes better.
Yeah.
Yeah.
And with this, we come to the end of this session, and thanks a lot. We overshooted the time, but still we have almost like around 97 people staying on the webinar. We thank each of you for being over here. And so sleep well. Your day starts with your good sleep, right? And then have the on-time breakfast, and then always keep hydrated yourself, avoid the ultra-processed food, and then better to go for a cold press oil rather than a processed oil. And it would be good if the budget permits, go for the ghee. And then the screen time, two things. Before the bed, half an hour. After getting up from the bed, 1 hour. We are just avoiding it. and we all help. The contact details of the doctor will be
The
given.
contact details, I
Yeah,
mean, I'm putting it over here. I'm just giving you my email ID. If you have any questions or queries or anything, please do feel free to
please.
reach
Yeah,
out to me.
yeah.
And I've also given the website of my clinic so that you could, kind of like check it out. I mean, it has the address, location, and everything.
Perfect.
So, yeah, thank you, Rajshekar Garu, for this
Thank you.
opportunity.
It's been so nice, and thanks a lot all the audience. I hope you always like the way how we are getting you the new topics for the betterment for having an happy, healthy, and wealthy life for each of us. Thank you, and
Thank you.
we again once again thank you, Dr. Karthik.
Are you
We look
welcome?
forward to come and meet you up in person again.
Of course, of
Thank
course.
you.
Yeah.
Thanks a lot.
Thank you.
Thank you. Yeah.
Yeah, thanks
Bye.
so much.
Bye.